Well, hey guys, in today's video, I'm going to be covering 10 dietary supplements that could be negatively impacting the health of your skin. As I go through this list, I want to emphasize to you guys, it's not necessarily an individual vitamin, mineral, or nutrient that is problematic and you should strictly avoid it. But the theme here is supplements that contain higher levels than what is necessary, especially in the absence of deficiency. Supplement number one is whey protein. Whey protein is really popular amongst bodybuilders, athletes, people looking for muscle building, and it has been associated with stubborn acne breakouts. It may be because whey protein is derived from dairy, and you guys know from my video on the connection between dairy consumption and acne that we do see in some cases some dairy products are associated with acne. We don't exactly know why this is. It may be due to the fact that dairy products lead to increase in the hormone insulin-like growth factor, which drives oil production, increasing the lipids on the surface of the skin, making a more hospitable environment for that little bacteria in the pore, Cutibacterium acnes, leading to acne flares. Not everyone who takes a whey protein supplement is going to have acne though. It's likely dictated by your genetics, but we definitely observe that. You also have to be careful, not all protein powders are just pure protein. They often have other vitamins, minerals, nutrients added, often at high levels, and some of these vitamins, minerals, nutrients, etc. also can be associated with acne flares, and I'm going to cover some of those common offenders later in the video. Number two is gummy vitamins. It doesn't matter the supplement actually, it's really in this case the form, gummy vitamins. Why? Well, they have sugar in most cases. They have corn syrup, some kind of sugar to make them taste good, which in and of itself is problematic. Food tastes good. Food has vitamins, minerals, nutrients. You shouldn't need a piece of candy with the individual nutrient in it. Gummy vitamins, they taste good. People may end up inadvertently eating too many. Sugar spikes insulin, leading to more oil production and flares of acne. I have a whole video on the clear skin diet, and in that video I explain how sugar can definitely worsen acne, and eating sugary processed foods can contribute to that. Throw in some unnecessary candy gummies and there you go, you have more sugar in the diet that's not necessary, that can contribute to acne. Also, high glycemic foods, sugary supplements, they contribute to advanced glycation end product formation in the skin. You guys know from my videos on the worst foods for collagen that processed sugary foods, they can negatively impact the health of the collagen and elastin in your skin, and that can lead to exacerbations of the visible signs of skin aging, deeper wrinkles, loss of elasticity. If you're gonna eat sugary foods, don't eat sugary vitamins. And taking in that sugar unnecessarily, it also can lead to more inflammation in the body. I mean, it's just like eating extra candy. Number three is B12 supplements. Now, I take a B12 supplement because I follow a vegan diet, and many people in the US are B12 deficient and do need to be on a B12 supplement. So I'm not saying they are, bad or anything like that. If you need to take one, you need to take one. Clarify that with your treating healthcare provider. Consuming greater than 5 to 10 micrograms of B12 per day is associated with acne. Why it happens, we're not entirely sure, but there is some research to suggest that B12 suppresses Cutibacterium acnes gene expression, and that's that little bacteria that causes acne, and it suppresses it in such a way that it causes bacteria to release more inflammatory mediators, leading to more acne. When you stop the unnecessarily high amounts of B12, then the acne resolves. Number four is actually pretty rare, so I don't want to be alarmist, but that is iodine. Iodine can cause a particularly inflammatory type of acne that is mostly associated actually with people who consume a lot of kelp. Kelp is a sea vegetable, is very high in iodine. And the breakouts with iodine are pretty specific. They're very inflammatory, meaning very red. They often happen on the trunk. There is an absence of what are called comedones, basically blackheads and whiteheads. Just all you have are these really inflammatory papules, bumps, and it varies from person to person. There was actually a study done by the FDA in the 90s that showed that some people are able to tolerate really high levels of iodine. So if you're somebody who has been eating kelp daily, a lot of it, and you're like, I don't have acne, then you're probably fine. Number five is biotin. Biotin is really popular in hair, skin, and nails supplements, and people take it with the hopes of growing long, healthy hair, but there's really no data to show that taking biotin in the absence of biotin deficiency is going to be beneficial for hair growth whatsoever. As far as the nails, there is some evidence that for brittle nails, taking 2.5 milligrams of biotin daily can help strengthen the nails, but you have to be careful with biotin supplements. They are, like these other supplements, associated with acne breakouts. This is another one where we don't know why it happens, but it's definitely been reported, and increasingly so in recent years as biotin supplements are gaining even more popularity and becoming even more widespread throughout the supplement market. People getting acne breakouts from their biotin supplements. I've cautioned you guys in other videos before too about the risk with taking biotin supplements is that it can interfere with the accuracy of certain blood tests that rely on something called a biotinylated assay. So if you go to your doctor to have your thyroid checked, they're going to send blood work, and that biotin supplement you're taking could interfere with the accuracy of that blood work and make it look like you have hypothyroid disease. If you are taking a biotin supplement, it is recommended that you stop taking it about a week before going in to have blood work. Number 6 is vitamin A. It's actually pretty easy to get to too high of a level of vitamin A when it comes to taking vitamin A supplements. Vitamin A is a fat-soluble vitamin stored in the body. Of course, there are certain health conditions for which vitamin A supplementation is recommended. For example, it's actually a part of the treatment for measles, but you have to be careful because it is a fat-soluble vitamin. That means it will be stored in the body, and it's much easier to get to high levels that can be toxic. Exceeding 25,000 international units of vitamin A a day is too much. Another way that you can get to too high of a vitamin A level is if you are eating polar bear liver. As far as skin manifestations of hypervitaminosis A or too high of a level of vitamin A, you're gonna get dry lips, dry skin, and hair loss. Hypervitaminosis A also can cause painful swelling of the long bones, and it can cause elevation in liver enzymes, problems with your liver. Number 7 is pretty rare, but definitely happens, and that is consuming too much vitamin B6 can make you sensitive to the sun. Specifically, the UVA rays can cause a photosensitive rash. Redness, even blistering. It can be pretty painful and uncomfortable. It's not that common of an issue because vitamin B6, it's a water-soluble vitamin, so excess levels, they're gonna be excreted. You're not gonna store it. So it's not really that common, but taking high levels can cause a transient increase in blood levels, and that can be associated with photosensitivity. Number 8 is selenium. You can actually get too much selenium. Selenium is touted as being beneficial from a cardiovascular point of view. It has heart health benefits, but you can definitely get too much of a good thing. And that can cause skin and hair problems. You can get hair loss. You can get this kind of rash that looks like sebderm, but more intense, with scaling, redness, sometimes acne-like breakouts on the cheeks, the face, the forehead. And you can have nail abnormalities with ridging of the nails, horizontal ridging. Oddly enough, Celinosis often presents with garlicky breath. Not sure why that is, but that is a presenting sign. Exceeding 200 micrograms per day of selenium is where you can run into this problem. A while ago, there was a supplement called Total Body Formula. It had to be recalled because on the label, it said that it had 200 micrograms of selenium, which is high to begin with, especially in the absence of any deficiency. However, on further analysis, the supplement was actually found to contain 200 times that. As a result, there were reports of Celinosis from taking this supplement. Now, vitamin B3 can actually be helpful to your skin and to your total body health. There are actually 2 forms of vitamin B3. There's niacin and niacinamide. Niacin is often given because it can have a cardiovascular benefit. It can help reduce your cholesterol levels. However, niacin can unfortunately cause flushing, and that is a very uncomfortable sensation if you have ever experienced it, burning, redness, and discomfort. Niacinamide is a form of vitamin B3 that we actually recommend to a lot of patients who form many skin cancers because this has been shown to reduce the number of certain types of skin cancers that these patients form. However, you can actually, again, have too much of a good thing, and it can cause itch. It can make your skin itch. Niacinamide, as a side note, is not associated with flushing, but it can cause dryness, irritation, and itch. Last but certainly not least is anabolic androgenic steroids. This is really popular in the bodybuilding community, people looking to build muscle. And it's not just amongst people who intentionally take anabolic steroids. Many supplements are adulterated with anabolic steroids and anabolic steroid-like compounds. Anabolic androgenic steroids not only can cause acne, but they can also cause male pattern hair loss, receding hairline. If you have a genetic tendency towards male pattern hair loss, otherwise known as androgenetic, because it's androgen and genetic alopecia, well then these supplements will hasten the onset of that. I mentioned that these steroids cause acne in many people. They can cause a particularly horrific type of acne called acne fulminans. Acne fulminans predominantly affects the trunk. You get lesions on the chest, the back, the shoulders, but it's not just pimples. It is these ulcerated, weeping, oozing, painful, necrotic skin lesions. Patients presenting with acne fulminans, they have elevated inflammatory markers. Their CRP will be high, which is a marker of inflammation in the body. They often have painful arthritis. They can have an enlarged liver, enlarged spleen. They can have fatigue, decreased appetite, weight loss. And it's actually thought that this type of acne fulminans, is more of an immune response to proteins on the surface of that bacteria that lead to this systemic immune response. And included in that systemic immune response are these ulcerative, painful acne lesions, mostly on the trunk. But then you have systemic issues. You have painful joint pain. You know, it definitely requires immediate attention. It's treated with a course of prednisone, which is an oral anti-inflammatory medication, or it can be treated with other immunosuppressive medications. There is a study done by the FDA of 776 supplements, and they show that approximately 89% of them were adulterated with anabolic steroids or anabolic steroid-like compounds. Namely, though, they were those that are labeled muscle building. So it's not like your multivitamin is going to have anabolic steroids in it or something like that. Specifically, those types of supplements that are taken by bodybuilders for muscle building, they can be adulterated with these things. And by adulterated, I mean, like, if you read the ingredients, it's not going to be listed on there. But when they actually go in and analyze the supplement, they find these compounds in there that can definitely contribute to acne. To be clear though, acne fulminans is pretty rare, but acne as a result of anabolic steroids is not that rare. That's pretty common. But this more severe form of acne, to be clear, is pretty rare. It's likely due to an underlying genetic predisposition to this. All right, guys, those are the 10 supplements that can negatively impact the health of your hair, skin, and nails. But I want you guys to understand that it's not so much the vitamin, the mineral. It's not like you have to go and read your food labels obsessively to make sure you're not getting too much vitamin B6. It more has to do with supplements and taking high levels of these things unnecessarily. Vitamins that are more likely to be problematic and lead to harm are those that are fat soluble. They're going to be stored in the body. And the fat soluble vitamins are vitamins A, which I talked about here, D, E, and K. When it comes to choosing a dietary supplement, you know, like I said, I take a B12 supplement. I actually take a multivitamin supplement that has B12 in it, that Athletic Greens drink. But always look for third-party testing that can help, you know, give you some confidence it's not going to be adulterated with things. So always look for things like the NSF certification. I think that is a good thing when choosing a supplement. Let me know in the comments, have you developed any skin issues that you were able to pinpoint to a supplement? Was it any of these ingredients that I mentioned here, or, you know, vitamins? Let me know in the comments, but I hope you guys enjoyed this video. On the end slate will be my video on the worst foods for collagen. So if you're interested in foods and supplements for skin and whatnot, check that out. I think you will enjoy it. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.